Good afternoon, everyone, and welcome to today's COVID-19 planning and preparedness webinar discussion. We've been endeavoring to have these presentations twice a week during the last several weeks while our organization responds to the emerging pandemic. As we progress into our planning, I think it's a really great opportunity for us to hear from some of our leaders responses to questions that we know are arising throughout the workforce and have been posed to us through the COVID-19 staff email line. So we formulated content today based on those questions, as well as some feedback from the prior webinar last week. So let's get started. I'm joined today by several speakers to address some thematic areas. Our President and Chief Executive Officer, Rob McIsaac, our Vice President of Human Resources, Michelle Leroux, our Vice President, Quality and Performance and Chief Nursing Executive, Kirsten Krall, and our Medical Director of Infection Prevention and Control, Dr. Dominic Mertz. Maybe to get started, what I'll do is ask you, Rob, could you give us a bit of a summary of the news of the week? I know it's been a very busy last several days, lots of information coming out of the Corporate Command Center, lots of discussion with the province and our planning tables. What are we heading into today? What is really top of mind for the days ahead?
Yeah, thanks very much, Aaron. So I'll do my best to provide a kind of flyover of some of the things that I think are most significant. We are seeing increasing amounts of community transmission associated with the virus now. So in terms of the new cases that are arising, over 60%, 65% in that region are attributed to community transmission. So in other words, people haven't traveled somewhere to have acquired the virus. There's not a clearly identifiable source for the virus, so you just know that it's out there in the community. So that's important for us in terms of context. We will use that information both in terms of our response today and tomorrow for personal protective equipment, helps to guide where we are with respect to that, but also gives us a better indication of where we are in the curve. We in terms of that demand for hospital beds, we think that by early next week, we'll have dozens of patients in the hospital. So we're definitely starting to ramp up. We have freed up literally hundreds of beds within the hospital, within HHS, through a number of different means. We've scaled back on ambulatory activity. We've scaled back day procedures. We've discharged as many people as we can. We've scaled back on surgery. So all of that has allowed us to get ready for the first wave of patients, which we feel we're now in a reasonable position to do. We are working hard to find new supplies of PPE. I know this continues to be a very significant source of concern for workers at the front line, both provincially and around the world. People are scrambling to try to shore up their supply chain, their source of PPE, and we're no different than anyone else. We are hoping to see some relief this week in terms of new PPE, but it hasn't happened yet. And even if we are able to achieve or receive some new shipments this week, we're looking at a long road ahead. So we are trying our best to conserve these very precious supplies for when we'll need it going forward, both today and tomorrow. In keeping with the guidance of the Ministry of Health, we've been using a risk-based approach to PPE use. We continue to extend the use of PPE across HHS, thinking about where the levels of risk are, and for the highest levels of risk, we're extending PPE. But as that community transmission and the number of patients within the hospital continues to rise, we will continue to scale up our use of PPE to try our best to have a safe workplace. I think the other important thing that's coming out this week is we are instituting a screening tool for our staff. So you'll hear more about that within today's webinar from Michelle LaRue. Again, this is aimed at trying to be sure that everybody who's coming in to work is healthy and safe to protect all of us. Maybe I'll just end by saying, acknowledge this is a very difficult time for all of us. We are thinking lots about how we can help staff out to be resilient through what is a very challenging period. In the coming days, we'll release some tips, guidelines, tools that you can use to try to make sure that you can sustain yourself personally through what I anticipate will be a very challenging time. It already is, but we're really just at the start of this in many regards. So please keep an eye out for those tools when we publish them, and take a look and try to practice some of those things, which I think will be helpful for all of us in terms of getting through this. So take care of yourself, take care of your families and your loved ones, and also please do your best to take care of your colleagues here at HHS. I always say healthcare is a team sport, so we need to be there for each other in this most challenging time. We will get through this. I'm very confident of the HHS team. I don't mean to diminish or downplay the extent or the scale of this issue that we're facing, but I also think it's hard to underestimate what a great team we have here at HHS. And so I'm very proud to be working with everybody through this challenging time. Thank you.
Thanks, Rob, for that overview to kick things off. We're going to take some time now to ask some questions of others on the webinar. Maybe Dr. Dominic Mertz, I could go to you first. It's always helpful to level set some of the work that we're doing with what's happening in the community. Rob alluded to community transmission. I know it's a public health purview, but as it relates to the presence and prevalence of the pandemic in our region, in our community, like how is that shifting our thinking about efforts that need to be taken?
Yeah, thanks, Aaron. As Rob already alluded to, we are in this shift from patients or individuals with exposures from international travel, eventually testing positive, to having community transmission happening. And the latter means that we no longer can follow up on the entire chain of transmission. It remains unclear from where a specific individual got the infection. And that's really the tipping point where you're moving from a public health perspective from a containment to a mitigation strategy. And the mitigation strategy is what we are all asked to do, namely the physical distancing combined with school closures of stores, etc., knowing that there are pockets of people out there infected knowingly or not yet knowingly, and reducing physical interaction as much as we reasonably can to what we always hear, flatten the curve, so to delay the infection eventually. Flattening the curve doesn't necessarily mean that there will eventually be less people infected. It means preventing that the majority of people get the infection within the same time period, which allows us as a healthcare system to more easily deal with the amount of patients that need medical care.
And maybe a follow-up question, a little bit different tack. Like, in terms of community transmission and the changing mindset around mitigation, what does that mean in our spaces? We are seeing occasionally staff members, colleagues of ours who are infected. Like, how are we keeping ourselves safe at work as this shift occurs?
It's the same concept that we would be using outside of the hospital setting. The complicating factor being that our space that we are working in is not necessarily welcoming to the idea of physical distancing for certain tasks. We need to work together, we need to work closely together. And these are certainly the areas, thinking of an OR, where people would be wearing masks anyways, so there's that level of protection there. Concerns are around cafeteria, lounges, etc., where people would huddle within a relatively small space, and these type of activities, I would say, should be avoided as much as possible. I feel like among healthcare workers, there's a lot of emphasis on the risk that's coming from the patient to them. But I always re-emphasize, this is not a hospital infection crisis, it's a community or public health crisis. So any healthcare worker coming in from the community is at some level of risk to carry or develop the infection. So we need to protect ourselves from our co-workers as well as from our patients, and practice physical distancing whenever we can.
Thanks very much. I want to keep moving on some content areas that are coming through on our staff line quite frequently. I know we are, in very short amount of time, we've significantly changed the way that we're operating our hospital. We've been taking measures to try and make sure that we can fill any gaps in our skills in our labor force. Redeployment is occurring as some roles now change as we free up capacity in the hospital. That continues to be an area of question for staff. So I wonder, Michelle Leroux, if I could ask you to comment a little bit on redeployment, specifically, since the government's invoked the emergency measures, providing emergency measures, who's eligible to be redeployed? Like, what does this mean for our workforce, and what can people expect as we go into this period?
Thanks, Aaron. We started with a memo on March 22nd where we informed our physicians and our staff about what the temporary government measures meant to us. And we continue to work to keep you informed and to also work with our unions as this progresses and rolls out. What does it mean? It means that any employee can be redeployed to support our patients as we see an increase in the volumes. What that looks like, only time will tell. We're working through the models, we're working through the process. We have set up a central redeployment center that will lead this work. And right now we're really working with our leaders to make sure that we can gather through a tool that's launching today, all of the staff that can be redeployed. Because as you mentioned, we have decreased some of our services, which is allowing us to then take those staff and redeploy them as needed out through the organization. And that will change on a day-by-day basis. As things change, we'll be able to look at what staff we can move where to best serve our patients.
Thanks for that. It's a huge undertaking, and I know a lot of people are being, certainly want to play a role and want to contribute to what's happening at our hospital and in our community. Maybe if I could, I'd like to ask a couple questions about screening. I understand we're about to launch a new tool to help staff complete self-screening before they come to work. Can you tell me a bit, how's that going to work?
Thanks, Aaron. Yes, so the communications went out yesterday. I'm thrilled to share that we've had quite a bit of uptake already. So thank you to everybody who has gone onto the link, and or soon you'll be able to scan a QR code if you want at the posters at the staff entrances that we are asking you to do before you get to work if you can. And it's really quick. I've done it myself a number of times. I was part of the pilot group. You enter in your employee information and answer a couple quick questions. And then you get this big green circle. that says cleared to go to work with the date, and or it tells you no and you contact employee health and not come to work. So it's a great tool that's been developed within HHS and with our partners to be able to make sure that we can keep our staff and physicians safe. And again, it's launching on Thursday.
So does this apply to all staff?
Yes, it does, Aaron. So we're asking all staff and all physicians who come to our sites to please complete this in advance of coming to work.
Got you. And this goes live on Thursday.
So we actually, you know what, I should course correct a little bit there, Aaron. So we're asking people to start using it now. They already are, but the actual screening boost will be set up on Thursday. So please get in the habit of doing it now. But on Thursday, you will see the screening boost there checking. I think the boosts are actually going to even come out on Wednesday just so you can get used to it. But Thursday is the true go live date.
Wonderful. I know these are complicated changes. And I know that the lead time is greatly appreciated by those impacted. I'm sure we can expect, like everything, for this to require some changes from everyone, but it's certainly worth doing to make sure that we're creating a safe environment.
For sure. And there's a number of videos and resources on the hub. So please, encouraging our staff and physicians to go there and just bear with us. We know this is a new process. It's going to take some time to work out the bumps as we go forward, but we're all committed to do this because we know it's the right thing for our staff, our physicians, and our patients.
Great. Thanks for that, Michelle. Okay, so I'd like to also take a moment to ask a couple of questions about personal protective equipment. It continues to be an area of evolving policy. As Rob pointed out in his opening remarks, we've been taking a phased approach to risk and looking to adjust our policies as we go forward, as the ministry has instructed us to do. I guess if I could, Kirsten Kroll, ask you to comment a bit, like, where are we at? What does that phased approach mean, and where are we at in that kind of spectrum right now?
So thank you for that introduction, Aaron, and happy to explain what we're doing now. So the ministry, or through Public Health Ontario, have described in some of their documentation a stage-wise approach to escalation of use of masks. And we are generally following that, and then a memo had gone out just in the last day to explain a little bit about these phases. So we're, if you look at that document, we're on phase 2. So what's happened so far is that in areas such as emergency departments, where again, we're not really sure, and knowing that there's more spread of the disease, they've got more variability in the types of patients that might be coming through, where disease may or may not exist. So we've really asked them to take on more of an active role of putting on PPE earlier and leaving it on for the durations of their shift as much as possible. It not only increases the protection of the employee and our patients, but it also helps us with some of that conservation and this concept of extended use of the PPE. So in this case, as an example, people would be putting on their mask and eye protection and wearing it most of the day until it's wet or soiled and they need to change out, and then they would don a new set. But it really is with that view that people more than likely will be having many more hours in the day where they're wearing that PPE. That strategy had then been further extended to our critical care areas, intensive care units in particular, where again, there's like a higher likelihood starting to evolve where those units will start to see potential risks rising. So they're now mirroring what had happened in the emerge department. There are other areas, again, where we know patients are visiting, although we've had a lot of restriction in our activities. But still, we have patients who require dialysis, interventional radiology, oncology visits, and so on. Those individuals are now kind of taking on that same perspective of putting on their PPE much earlier in the day, and then they are carrying it or wearing it for the duration of the day as much as they can. So the difference between what we call extended use, so as soon as somebody starts to use their PPE for the day, they just simply leave it on. If they started with a surgical mask for the day and their eyewear, they would leave that on until they switch perhaps to an N95 because of aerosol generating medical procedure. If that's donned, they would just simply leave that on, always changing the gloves and masks or the gowns between patients. Our next stage, which is what we're seeing now in emerge departments starting to evolve, and as I mentioned, some of these other ambulatory areas that have a lot more contact with individuals from the community, we will go to what's called more universal PPE use. So again, at the very beginning of their shift, as soon as they start to have interactions with patients within 2 meters, they start to wear their PPE, and they will again leave it on for the duration as much as possible. If again they need to switch out to a different level of PPE, they would do that, but again leaving it on between patient encounters. So it's a way of increasing the protection of our healthcare workers with certain patient populations. We've been trying to stratify that level of risk. So again, the subject matter expert team is gauging that level of risk all the time, both what's happening in the community, the care that's being provided in the organization, and trying to gauge the stepwise progression. You'll see more and more of this start to expand in the course of the next few days. Again, some of this is very dependent on also the supplies that we have available. It's no surprise to anybody that the global picture around supply chain is still a massive challenge for everybody to get the quantities of materials that they really need. So again, we have to try and engage and find that fine balance, weighing this always against the risk that we are anticipating, not necessarily just today, but what will happen the next few days. Eventually, we may get to a level that's even more, so that even beyond healthcare workers, we might then start to see wearing of certain levels of masks and so on. But that we're not there at that point, but you will feel that transition start to happen. And I already know some areas are connecting with me saying, well, why aren't we wearing masks all the time yet? And just understand that we're making those decisions based on risk levels all the time. So again, there's many factors that are going into that, but more and more of that will continue to evolve.
So it's two very different things then, an extended use versus universal.
Correct. They're not drastically different, but extended wear certainly gets us to a much broader level of protection and conservation approaches concurrently, and universal takes it one step further. So basically when you're coming through the door with universal protections, you're starting out your day pretty well right from the beginning with PPE as soon as you start to have those patient interactions and they're within that 2 meter distance.
And so some of the risk factors, you mentioned there's a number of them, would include the number of patients that we have and the expansion of the pandemic in our region. Is that fair to say?
Yes, it is. And of course, we are keeping daily tabs on what's happening in the Hamilton area, comparing what's going on with our other organizations, you know, what's their read of the environment as well. And again, always putting the lens of what are the unique characteristics of the populations that we're serving as well. HHS, of course, is quite complicated in the types of patients that they're serving. So again, those are all factors that come into this.
Thank you very much. I'm conscious of time. We do like to keep these presentations crisp and easy to digest in one sitting. I'm going to stop here, but recognizing there's lots more we need to talk about, we'll be having another one of these sessions on Friday. These are recorded and posted on the hub so they can be distributed between people at HHS and listened to whenever your time permits. We'd encourage people always to keep submitting questions. You can do so at the staff COVID email line, which is accessible on the hub, so that we can continue to frame the information around what matters most to our workforce as we plan for this pandemic. You can also always sign up for the hub app, which pushes the latest information that's going on in the organization as we prepare, and always check there for the new policies that have been implemented. I know it's a challenge to keep up with all this. We're doing the best we can to try and make it manageable. We're open to suggestions if you have feedback on how we might do that better. And anyways, until next time, please stay safe, and we'll talk again on Friday. Thank you.